Magic 89.9.
I gave the time away, right? Hi, everyone. Welcome to Healthline. I'm Tina Ryan, and with me is my co-host. He's sounding a little sexier than usual.
I wish.
Oh, diba? But hi, Doc Rylan.
Yes, it's Doc Rylan. Oh my God, my voice.
Oh my gosh,
terrible.
super raspy.
I know.
Okay.
But you're still with Healthline.
No.
Tina Ryan and Doc Rylan.
How's your weekend?
Well, busy as usual.
not weekend, but like the start of the week. Oh.
Well, start of the week, clinics and stuff. But the weekend was like filled with all of other activities left and right.
I know. All day last Saturday you were in Novotel, right? Was it Novotel?
Yep. We just finished the 40th annual convention of the Kansas City Medical Society. So
nice. Congratulations.
40 years,
wow.
Imagine. But the actual organization, we're like 75 years next month.
Nice.
Oh,
okay.
Correction, not next month. It's July already.
Oh,
so it's this month. It's this month.
July. Okay.
I know,
July.
right?
July na. Anyway, for those of you watching us on playback.tv/magic899, hi. Thank you so much. Hi, Christian. I appreciate that. He says prayers to my dad. Thank you. And Christian, he ate last night. I was so happy. Woke up at 1 a.m. My dad was hungry. I was like, oh my gosh, we have leftover food. And he ate like a rock star.
Feed him. Yes.
Oh, I was so happy. I literally slept with a huge smile on my face.
Good to hear.
If you have any medical related questions, we have a doctor in the house. Well, he specializes in orthopedic surgery, but he's still a doctor, so he knows a thing or two. You can give us a call, 863-10899, or the Viber number is 0945-971.
Oh, yes.
4011. So, in second hour, please do not go anywhere because Doc Rylan invited a very good friend of his.
Yep.
We're going to talk about skin.
The face.
This thing that I've neglected for like a half of my life.
It doesn't appear to be. No.
Like, seriously, I'm always ashamed to talk to a derma because I'm like, they can tell that my skin's dry. I'm not taking care of it.
Come on.
Yeah, but anyway, so it's
We'll
me and
learn
Doc
about
Rylan.
We'll learn about that later.
Let's get back to more of today's best music. This one's from Jessie J. Oh, Doc, living our best life.
I know.
Magic 89.9.
Hi, this is Healthline with Tina Ryan and Doc Rylan. Doc Rylan, I was told. I'm giving you like bits and pieces of trivia, Ziba.
I know.
I was told that I lost it. wait lang, Doc. The heart beats over 100,000 times? Like
That's when? A day?
Wait. Oh my gosh.
I'm poor in math. Hold on. Let me compute.
You can't even talk anymore. If you have any questions for Doc Rylan, please. He is an orthopedic surgeon, by the way. Ayan. 100,000 times a day.
A day.
Heartbeats.
Let's do some math here.
Diba?
I'm poor in math.
Goodness. I struggle with 10,000 steps. The heart does 100,000 beats.
I struggle with...
I struggle with math.
No, but the thing is, we'll do the math in a bit. But the difference is when your heart beats, we call it cardiac muscles moving, which means they're like involuntary.
So I can say that to my crush. Hey, what? Say that again.
Your cardiac muscle.
My cardiac muscles are.
They move.
Are voluntarily moving.
Involuntary.
Oh, involuntarily moving because I'm thinking of you.
Exactly. So they move whether or not you'd want them to move, they actually move. In contrast, your skeletal muscles are all voluntary. So the difference is that 100,000 beats a minute. That's like continuous. That's continuous. I mean, a day, sorry. That's continuous. In contrast to 10,000 steps, it depends on do you do the 10,000 steps or would you want to do the 10,000 steps?
But it doesn't equate. Right? 10,000 steps and 100,000 beats. Yeah, we'll figure out the math.
Well, yeah, we'll do the math in a bit.
Yeah, later. Yeah, we're no math experts, but
Yes, we're not.
please, if you want to learn about I don't know, the skin, then stick
In a bit,
around.
yes.
Yeah, because we have Dr. Ann Margaret Vicente joining us for our second hour, and she is a dermatologist, and she also happens to be the president of the Philippine Academy of Medical Specialists.
Yes. So we're going to talk about the face, the skin, and everything else we can and are not supposed to put on it.
Ang sarap pag doktor yung partner mo, no? Siya yung naghahanap ng guest sa show, guys. I love it. I feel so blessed. 6:26, Doc. I have to take a quick break, and then I'll be back with something from Lola Moore. How's that?
Sure. Let's go.
Magic 89.9.
Today's best music, Magic 89.9, 635 on Healthline. The latest from Rihanna, called Friend of Mine, and Doc Rylan's daughter, Bella, who I met last week. She's so adorable.
I know.
This to say. Thank you for the trivia, Bella, but it's just too funny. Say it, Doc. Tell them.
She was saying, I can't believe the only way we got a new Rihanna song is actually through a Smurfs soundtrack.
Which I've never seen. Have you seen that? Have you seen the Bella?
I haven't.
Bella, you're so cute, I swear. Feel
she
better.
Although she's saying, Rihanna, come back to us. She goes, no, I have been exposed.
Oh my goodness. For those who just tuned in, I'm Tina Ryan. With me is Doc Rylan Flores. He is an orthopedic surgeon, DNA profiler, co-host of this medical show, your go-to show on Wednesday nights here on The Magic.
Here.
So a little trivia before I play the next song. Did you know about this artist? He had a stutter. He was stuttering growing up.
When he was younger, yes.
Yeah, and I guess rapping sort of healed or made it go away. Rapping to Eminem songs.
Well, rapping kind of makes your mouth move really, really
Right.
fast.
Well, what causes stutter anyway? Is that like a neurological condition,
It
Doc?
depends. It could be, it could be not.
Okay.
So it really depends. That's the reason why for early detection of stuttering, we ask help from our friend neurologists
Yeah.
to actually determine if there's something wrong, cranial or otherwise, or probably not,
Yeah.
or probably environmental. I mean, there are a whole lot of things that could actually cause it.
Environmental.
We could probably call in a neurologist and a psychiatrist to actually find out the dealings with people who have speech problems, stuttering included.
Nice. Oh, well, maybe one of these days.
One of these days.
One of these days. Talking about Ed Sheeran. This one's called Drive on today's best music.
Magic 89.9.
Today's best music, Magic 89.9, 650 on Healthline. Tina Ryan here, along with Doc Rylan. Hi.
Yes, hi.
Playhouse from Devon Colt. Playhouse. So kilig. Nox. Doc, wait. We did the math. In between the music sweep and commercials, okay? So we're going to break it down for you. But right now, I want to say hi to everyone, again, on playback.tv/magic899. Also to Nurse Vienna.
Oh, hi.
These wonderful group of nurses really took great care of my dad. Everyone at ACE Medical Hospital. I think that's what it's called. Thank you. Thank you so much. Nurse Vienna. She's so cute, dog. You see her smile? Her eye smile along. Ano yun? Yung nakatawa pati yung mata.
Everything's lighting up.
Yeah. Like, I mean, that's the kind of face you want to see when you're, not feeling good. Diba?
Brightens up your day.
Right. That's true. So again, everyone at ASA Medical, thank you so
I'd
much.
also like to say hi. I have a couple of friends listening right now.
And your assistants are tuned in, right?
Yeah, friends of mine. Veronica Turalde, of course, and Grace Leyva. They're listening right now. Not giving them a difficult time because I'm here.
Hi, thank you so much for tuning in. Don't forget, next hour, we're going to talk about skin.
Skin,
Because it's the
yes.
biggest muscle in the whole, diba?
Yep.
Pinakamalaking muscle
Yep,
siya
yep.
to. Yeah. So we're going to talk to a dermatologist who happens to be also the president of the Philippine Academy of Medical Specialists.
Yes.
Dr. Ann Margaret Vicente is joining us, second hour of Healthline. So going back to the math, break it down.
Yeah, we were talking about the whole day, right?
Yeah,
So that's 100,000
100,000 beats per
for the
day.
day.
Okay.
So technically that's the average. Because if you look at it, 24 hours in a day, 60 minutes in an hour, and 60 seconds per minute, right?
Yeah.
More or less. So if you do the math, there's 60 to 100 beats per minute.
He really did that. He really did the math.
I did. So on the average, that's 100,000. But the limits, it's not supposed to go less than 86,400 beats.
Okay.
And it's not supposed to go beyond 144 beats.
Which is
per
more
day.
dangerous? Slowing or faster?
It depends. It depends on your activity. Because if you do, you move, you do exercises, you get angry, you cry, you even eat, it actually increases.
What decreases heartbeats then? Like
Well,
when you're relaxing,
when you're
and all.
relaxed, it goes down a bit. But this is average of 60 to 100 per minute because you can't count the whole day. So you do count the minutes. So it's 60 to 100 beats per minute. So if you go higher than that for one reason or another, that's called tachycardia.
Tachycardia.
Tachy.
Okay. Is that
But
like
it means
another term
more.
for like a mini heart attack, Doc?
No, not
Okay.
necessarily. It just simply means that it's more than 100 beats per minute.
Okay.
But if it goes less than 60, that's called a bradycardia.
Okay.
Not Brad Pitt, it's bradycardia. Okay?
Thank you for the tip. Saying hello to Julius all the way from the Czech Republic. Check you out. Thank you,
Yes.
Julius. Also to hi, Tita Aaron. I'm playing matchmaker again.
Hindi ko alam kung sino kinikilig na doon.
Ako, yung matchmaker ang kinikinig. Anyway, so Doc, I heard about cough CPR. Please tell me what that is because they say that this could actually help save lives. What is cough CPR?
Well, there's actually this. What they're saying is that if you do feel something, a little chest pain, a little fainting, or a little out of the ordinary, coughing out literally would like excite the areas, and hopefully it won't really. It won't proceed to any problem.
Wait, like just like literal na
Literal coughing out.
ganon?
Yeah.
Like I'm gonna let it out.
Yeah.
I mean, the louder the better?
The louder the better.
Okay.
But that's what they're saying. Of course, it still beats going to get yourself seen and checked on a regular basis.
There you go. Cough CPR if you want to Google that. So, yeah. Again, 6:54 here on The Magic. Let's get back to more of the music. Here's something from Lord called What Was That? Yeah, I had a what was that moment yesterday. Here we go.
Magic 89.9.
Doc Rylan actually stood up, and I was like waiting for him to bust a move or something.
No, because I guess right.
But I swear he's such a huge
reasons.
K-pop fan. I'm still trying to wrap my head around it. I'm like, he's like this, tall, like big muscular guy with long hair, and he's like into K-pop. I love it though. I love it. Welcome to the second hour of Healthline here on Magic 89.9. Saying what's up to Kim. Hi, also to Enrix. And again to Tita Aaron and Julius from Czech Republic. Mike is in the car. He just came from the deli where I've been wanting to take you guys.
We have to go there.
717 Deli in Connecticut. They have a new sandwich I'm just dying to get my hands on.
We got to try that.
I know. Just say when so I can take you guys there. But anyway.
When?
Hi, Mike. And finally, hi. Our
There we
beautiful
go.
guest is here. Wala na daw warm up, Doc. Let's go.
Yeah.
Let's do this. Let's
Have
do
a seat, have a
this.
seat.
Hi, Doc.
Yep.
Oh my goodness. Look at her. Looking so lovely. We were just talking off air, Doc.
Yeah.
How I'm always afraid to meet a dermatologist because I know that it's obviously I don't take care of my skin so much. So alam mo yun, nahihiya ako talaga minsan humarap sa derma, Doc. But I got a good one now. She's taking great care of me. Hi, Doc Gisela and Doc Rich of
Yes, hi
Skin.
Gisela and Rich.
They're good, very good dermatology.
Ladies and gentlemen, on Healthline, she is the president of the Philippine Academy of Medical
Yes.
Specialists. She is a dermatologist in the house, Dr. Margaret Vicente.
Thank you. Good evening.
Hi, Doc. Kamusta naman? Super traffic.
Yes po. So sorry.
It's okay. I mean,
It's okay. You actually just came right on time.
Yeah.
Okay.
Pero sabi ni Doc, wala nang warm-up yan.
Sinalang, no?
Thank you so much, Doc, for making it
Thank
here.
you for having me. Yeah.
And I mean, all the friends of Doc Rylan are like more than welcome to come back. So there's another invitation.
Wow, thank you so much.
So if you have any questions, we're going to talk about skin.
Yeah.
Okay, skin. Okay, first question, Doc. I did have my... Ito na naman, wala na naman. Ay, my codico. So the skin is supposed to be the biggest muscle.
Yes.
Organ.
Organ in the body.
Okay, organ in the body.
Yeah.
And why do
90%.
we neglect it so much?
Yes, that's true. We do actually, especially for us here, Filipinos. It's only recently that we started the trend for using sunblock because we believe na okay lang na walang sunblock because we're protected because of our skin color. But actually, for me, that's one of the biggest mistakes that some do. It causes early photo damage if you actually don't use sunblock. So one of the most important
Oh my gosh.
things you
Photo
must...
damage.
Yeah, photo
What
damage.
exactly is photo damage?
Isn't that the Doc? I think if I remember correctly, parang may test and then they take a picture of you or under
Yeah,
a UV light, parang ganun.
Actually, they take a picture of you under a UV light
Yeah.
and shows actually which parts are more aged than the others. So this is actually because of exposure to the UV rays of the sun. That's why there's photo damage. So before, it was not extensively studied because people wanted, especially the Caucasians, they wanted to get
tan.
tan. Yeah. So when the skin cancers become more famous because of this tanning salons, then the advent of sunblock, sunscreens came into
play.
Yes. And then for us Filipinos, since we think we're in the equator, so we're
Sanay na tayo, ganun.
tapos dark tayo.
Dark skin.
So actually, being a little bit on the darker side, your skin phototype being darker than the usual Caucasian color will actually be protective for you. But hindi
But,
naman
wait, I'm
sinasabi.
hearing a but.
There's a but. But hindi naman pwede wala pa ring because
protection.
because our ozone layer is already been depleted.
Yeah.
So there's UVA, UVB, and recently UVC na. So medyo madami na sila.
Okay.
Something new today. UVC?
Yes, there's
What?
also UVC.
I blame my mom for the depletion of the ozone layer sa hairspray.
Yung time nila. no?
Yeah, diba? Aquanet.
Oh my God.
Diba? Pero Doc, but like, ang tanong ko, ito lang, personal to
Yes,
Doc,
yes,
because
sure.
my dad was just released from the hospital, and last night I was helping them. Napansin ko parang unfair na mas makinis yung daddy ko.
Because maybe your dad stays indoors more than you.
Like, I swear, he doesn't moisturize. And I was looking at his legs and I'm like, Dad! Paano nangyari?
Your skin-
Actually, you have to also take in. Well, it's supposed to be genetic. So
Oh, it's my stepdad. Parang, unfair! Kasi super, like, ang kinis niya. Like, balat mayaman.
Kasi sometimes I tell my patients, we have to think that why is it like she doesn't age? So, well, you have to consider that genetics come into play also. So some people really age faster than others, and then it's also in their genes. But you also have to realize that taking care of your skin will also prevent the aging process.
You were saying something about being indoors. Does that have a lot to do with it?
Actually, if you're indoors and you don't actually use sunblock, so you're more protected than somebody who goes outdoors and not use regular sunblock and not use regular skincare regimen. I, for one, I'm not an advocate of like step 1 to 13
Oh my
regimen.
gosh, I have no... Oh my gosh.
I don't have the...
Diba?
Even as a dermatologist, I don't have the patience for such a long... I mean,
Step 1
I
to
love how-
13? I've heard like 10, but this is 13.
yeah, some
Seriously.
have 1 to
What?
13.
Okay.
I'm not gonna run through it because I don't usually do it. So I just do like 1
What's
to
a
4.
basic that needs to be
I
done?
do a basic.
Okay, how basic is basic, Doc? Please
Okay.
walk us through.
Like for me, if you have a really good cleanser. Usually a cleanser with a mild like small beads that will
like for micro
exfoliation.
yeah.
And then it's
So
mild.
soap doesn't count as cleansing.
No, because not all soaps are created equal.
Oh,
So some are actually drying, some are.
Oh, okay.
So for me, if you ask me, that's where the secret lies. That's why you see a dermatologist, so that the proper soap
Okay.
can be
So
prescribed
not
to you.
all soaps are created equal.
Yeah.
yes, because I remember every time I have a breakout, Doc,
Yeah.
my sister would tell me, ito yung gamitin mong brand.
Yes.
Kasi matutuyo daw agad.
Yes.
And it
Because
does
there
work.
Because some are loaded with glycolic acid, some sort of acid to dry out the skin, so to lessen the breakout. So if you tell me that, Doc, I wash my face with Safeguard, like, wow, that's so wrong for us to hear that.
Okay.
Or I wash my soap with Perla. Labada po ba yung mukha?
Kinula yung face.
Kinula yung face. So anyway, I used to get...
So cleansing is the first thing.
Yes, cleanser. And then the next step is toner. Toner, usually, you can put medicine.
That's two already. That's two.
Yeah. The toner
I'm way
usually...
beyond.
So, okay.
Okay,
Cleanser,
toner.
toner.
What is a toner?
Actually, the toner, it preps the skin. So,
Preps.
Preps the
preps the
skin.
skin. So,
Okay.
for the next step,
Which is
for me, I usually advise a serum. So, the serum already has the ingredients that's like anti-aging,
Okay.
antioxidant, whitening, so that when you put the sunblock and then your makeup, it will stay. Actually, it will stay. Kakapit siya sa face.
Okay.
Because your face has been prepped well.
From the toner.
From the toner. No, from the start. Cleanser,
from the
and
cleansing,
then toner,
yeah.
and then the serum.
Like, you don't need it
I'm
anyway,
looking-
Doc Rylan. Makinis ka eh.
Jeans.
jeans. The serum usually comes from where?
The serum usually is like a milder form of the cream or the... So you can infuse it with whitening, stem cell. Depends on the line that you're using.
Gosh.
Okay.
Doc,
It's the same as-
I've seen videos on TikTok with like women with so many like steps.
Yeah, I've seen that too. And then I
mean-
just laugh because sometimes it's an overkill.
Okay. I mean, does the skin really able to absorb that much?
Actually, if the ingredients really are
Proper
good
and
well made, so these steps will be one on top of the other. But I'm actually, if you're a busy person, you cannot
you can't
follow
do.
these steps.
Yeah.
So it would be useless to be prescribing a lot, and then
Okay.
the patient or your client will
Yeah.
be busy. Okay, I'll just do this and this. So the rest will be a waste. So for me,
it's better to actually have the basic steps.
the basic
than
steps that's
have
already
everything.
loaded.
Yeah.
Yeah, I'm not an advocate of like 3-in-1, everything there. But at least if you have it
Parang
like...
kape lang, Doc.
I was gonna say, is there 3-in-1?
I know, I was gonna say, baka meron ng 3-in-1, Doc.
Wala
So,
pa eh.
ito-
Nahanap din ako kasi tamad din ako, di ba?
But
No, but I love the
It's
honesty,
just
diba,
3.
Doc? Oh.
What's the fourth?
For the morning is the sunblock.
Oo.
But at night, you can add an eye cream for more mature skin.
See? May eye cream pa, and then there's
There's the
moisturizer.
moisturizer. You can choose moisturizer or cream type. Yeah.
Okay.
Doc, hindi ba pwedeng yung moisturizer, like, do I really have to put it under my eye? Or is there like a moisturizer that's just like for the whole face?
Yes, pwede na. There are some moisturizers already na. Actually, the one I use, the one from our clinic, is actually what I use the whole face already.
Nice.
So not specific, I don't anymore like specific place
Under
for the
eye, mga
under
ganun,
eye.
yeah.
Kasi, well, there's already...
Ipapahid mo rin naman.
That's what my point. Sa mga tamad yan.
Sorry.
Oo.
And then you don't pahid ha if it's eye cream.
Oh,
Yeah, you
you
pat.
pat.
Pat like that.
So it will be absorbed. Yeah. So it's not, pahid.
Oh my
Yeah.
gosh, my boss and I went to the ex-boss of mine and I went to Australia one time, and we were all in a hurry, and she was like, "Oh, grab this, grab that." I go, "Oh, let me just wash my face." And Yung sabon ko talaga to. Sabi, hoy, wag kang
Yeah.
Na-shock siya. Ba't
Na-shock
ganyan kang kaan? I guess there's where am I going with this?
Yes.
There is a proper way
Yes.
to
Yeah,
Wash
the
your face.
strokes.
wash your
Yeah.
face and
Do the-
pressure, di ba, Doc?
Yes, it has to be like a
Do the
light
bumble
pressure.
shake.
Doc, ano ang tama? Because grabe, nabura
Yeah.
daw yung mukha ko sa pag...
Yeah.
And I'm like,
Because if you do it so harshly, of course you will strip the face of all its oils, moisture, and everything. So you have to do it lightly and then in a circular motion. So you will lift
I'm
up.
trying.
Yeah.
I'm trying to
ang
imagine.
hirap paging babae, di ba?
I'm trying.
Sila
No,
din.
wait.
Meron din
But-
mga lalaki, no?
But I heard, yes, I was about to say that.
Yeah.
I heard these are not just rituals
Yeah.
for women. There are for men as well.
Correct.
Well, yeah, lately also the men have been kind of sumahabol, di ba, Doc?
And then it's more difficult, especially kung may balbas sila. So they have to have like a special another cleanser for that because some have
For hair.
for the hair,
Facial
the
hair.
It's like you're
different from,
shampooing.
from the hair.
Really?
On your head,
But
yeah.
most of the cleansers,
Release it.
you can use it naman na for the face, except for if you have irritations during shaving.
Okay.
So then that would require an additional medicine.
Oh yeah, because sometimes when I have a clean shave, which I don't do anymore, sometimes you get those bumps.
Yes, it's because you get the
irritates.
bumps. It's irritated, so you have to
Yeah.
treat it again because these
Oh, I
bumps,
get it, I get
they're open, and then since you shaved with water, sometimes the water irritates, leads to the.
Even if I use distilled water.
I haven't thought of
don't.
that. Maybe it. Maybe you should try it and tell me.
Probably.
7:24 for those who just tuned in. This is Healthline. Doc Rylan Flores is with me, my co-host tonight. I'm Tina Ryan, and with us is dermatologist Dr. Ann Vicente. Doc from Mariel of Makati. My face gets super oily halfway through the day. Any tips?
It actually depends on how old Mariel is. She can actually do.
May ganong factor.
Yes, if she's in the mid-age, 20s, 30s, maybe she can also take oral acne medications to lessen the oiliness of the face. But if not, you can wash your face midway with like oil preventing soaps with, as I mentioned, glycolic.
Yeah.
But this time, you just have to up your cleansing because you have to wash your face again.
In the middle of
and
the
then
day.
in the middle of the, instead of doing it morning and
Okay.
evening,
So you have
can,
something in the middle of the
you
day.
do the middle to lessen the. But
Do you get a chance to look into the skin if they're relatively oilier or drier?
actually, if it's really oily skin problem, we usually really prescribe the oral tretinoin to lessen the oil
But
gland.
you're supposed to have normal oils naman. diba?
Yes, you're supposed to have
It's not
normal
just
oil.
too
Yes.
much.
Not just too
Ah,
much.
okay.
So if you really have too much, you have to. It's either you give vitamin A if the patient doesn't want to take
Okay.
tretinoin, or you can give the oral so that it lessens the oil production. Because having a very oily face midday, it's actually not normal anymore.
Yeah, and they
So,
say
the
oiliness
whole day.
is next to poverty.
So,
Ganon. My gay friend told me, oiliness is
don't
next to
think I've
poverty,
heard
girl. Doc, the more you scrub, the clearer your skin. Please debunk
No.
that. Okay.
So it's a myth. So
Okay.
actually, we just recommend like every 3 days of exfoliation, deep exfoliation. If you do it regularly, as I said, still you strip the skin of its natural moisture. Thus, the barrier function of the skin is disturbed. So the bio.
Won't you get like abrasions and all of these things? when
Actually,
you do
some
scrub?
do.
Okay.
When there was a time that like diamond peel was
Oh my gosh, I was addicted to diamond peel, Doc.
you'd see some,
Oh my gosh.
So they literally strip it.
yeah, there
Lahat di siya, Doc, after.
yeah, we
Sorry.
sometimes see patients with
Yeah.
scratch marks.
Yeah.
Like they have like
okay.
cat scratch marks from too much Diamond
They
peeling.
don't do that anymore now.
Actually, it's not that popular anymore.
It's yeah, but I remember mga around 2003 or 4,
Yes.
super
Early 2000.
uso yung
Super uso
balikbayan pa ako nun, Dok. So, kailangan yung 2 weeks time ko dito, di ba?
Ilang beses ka nag-diamond
Grabe,
peel.
Dok. Alam mo yun, parang na-strip off talaga yung mukha.
Yeah, it really strips off the
Parang
natural
update.
bio.
Medyo mahapdi siya pag ano.
Yes,
pag
it gets mahapdi talaga. And then the unfortunate part is kung applyan pa nila ng peeling solution.
Yeah.
Ang hapdi na.
Ouch.
Oh, yeah.
Doc, UV rays are everywhere, even on cloudy days or while driving. Myth?
True.
True. So,
Yeah. Even indoors, actually.
What?
If you if you're an actress,
These
actor,
lights.
keg lights, yeah, they do have. So actually, even indoors, if you're working under a bright environment, we do. That's why.
Is this classified as bright environment?
yeah, how's our lighting, Doc? Pero,
I think it would be safe to put sunblock in the morning, even if you, yeah.
How much sunblock do you actually need to apply?
Actually, it's a half a teaspoon for the face.
Half a teaspoon.
Yeah.
For
For
the
the whole
face.
face and neck, yeah.
That's a lot.
Yeah.
Or that's supposed to be how much? You're
It's supposed to be half a teaspoon. So, konti lang din naman ng teaspoon, Doc. About,
That,
2 ml.
that's regardless how big or small your
actually,
face
well,
is.
of course, if it's a little bit smaller. But, you really see the...
And is that application only just once or you have to reapply?
If you're outdoors, you have to reapply it. Depends
soon?
on how much the SPF.
naku, may
Oh,
ganun pa
wait,
kasi di ba
wait.
may SPF?
Yeah. If it's SPF 50, it's actually...
100.
Meron na di ba? Anong pinakamataas ngayon, Doc, na SPF na nakita mo?
Actually, it's usually I just prescribe because it's not actually the kung gaano kataas. It's how you reapply it.
There you go.
So actually, we recommend reapplying it talaga mga every 2 to 3 hours.
Yeah.
Especially if you're outdoors.
And before you apply it daw, Doc, tama ba,
Yeah.
Doc? Half hour before you actually go
Swim
out
or-
into the sun or swim.
Yeah, when you do swim, do you reapply immediately? Or
No,
not
you
yet?
actually reapply for swimming 40 to 50 minutes after complete like in the
Drying
water.
out and all.
No, after being in the
okay.
water for 40 to 50 minutes, you
Okay.
reapply because you wash it off while we're
Yeah,
in
because you're in
the
the water.
Oo.
Okay.
I have to take a quick break. This is Healthline. If you have any questions for a beautiful dermatologist, please send them our way, 863-10899 or the Viber
Or the
line.
Viber at 0945-971-4011.
Magic 89.9.
What you doing tonight? Listening to Healthline.
Yep.
You guys better be. Dakila, before I get to your question, how to treat acne scars, Doc. We have Doc and Margaret Vicente, dermatologist and president of the Philippine Academy of Medical Specialists with us. And of course, my handsome co-host, Doc Rylan Flores, here on Healthline. What was I gonna say? Fine. Unahin natin si Dakila. How to
Let's go
treat
for it.
acne scars.
Actually, acne scars, you have to do an in-clinic treatment. So, because there's no cream or like
Okay.
magic that can remove acne
scars.
scars. Because it's actually scars. So,
Yeah.
from its word, it's difficult, especially if it's deep and then multiple. So, we usually do it's either ablation with laser.
Yeah.
So, we have the fractional laser. And then we can also do the rollers, the dermal rollers.
Ooh, yeah, that's a little
Because-
painful.
But it's the concept there is you create injury so that collagen will be recruited and then the scars will lift up because there's another injury. So you re-injure the scar to lift it up, to lessen its appearance and to make it more makinis. So
Sana yung puso ko ganun din, no?
that everybody would wish that.
Puro
Pwede
sakit lang
sugatan
eh.
ulit,
Oo,
di ba?
nasugatan lang ulit. Mahapdi na naman.
But these are, you were talking about scars.
Yes.
But what about the acute, like pimple eruption?
You know, I was
The
gonna
acute
ask.
one. Because these are already scars. So,
Yeah.
But what if it's just like new pimples?
Actually, if you have new pimple,
Is that your body's
eruption.
way ba? Kasi di ba, Doc, organ nga tong balat natin,
Yes,
tama?
yes,
So
yes.
pag may mga ganyan tayong pimples, is that a red flag? Like,
Actually, we really have natural bacteria in the skin.
okay.
Then the natural
Kaya dapat
bacteria, the
maligo.
food is the oil.
Yeah.
Yeah, so if dadami yung oil, dadami yung food, yung natural bacteria, it becomes pathologic or it becomes bad. That's why you get breakouts.
Oh, so talagang
if you-
nakukuha sa oily
Yes,
food.
sa oiliness of the face, and then there's already a study that oily food, chocolates,
add on
nuts
to
will
it.
add on because it's
That's why
oily.
chocolates are really not
Dati it
that
was
good.
just parang sabi-sabi lang. But there's really a study na
No,
it increases kasi the oil of the body. Kasi may mga oil
So
siya.
that will increase your oil
That will-
production in the face
yes,
as well.
sa face as well. And then which is the food for the P. acnes. So the bacteria.
The bacteria.
And then you have the breakout. So now, if you just had the breakouts, I've seen quite a lot come in for treatment of acne. Big acne.
Like yung cystic?
Yeah, cystic, pustular.
Big
If
ones.
it's being treated regularly, it usually doesn't scar.
But
You
that's it.
lessen.
You have
lessen
to
the
have it seen
and
as
you have
early
to
as
have it
possible.
treated in a clinic by a doctor. Kasi there's a proper way to extract the pus and there's a,
Wag tirisin.
yes, of course.
Oh my gosh, I'm
the
like a
moment,
pimple popper, Doc.
because the moment you pop it,
Yeah.
you injure the skin.
Yan guys, solo ko. Kasi tagal na. Siguro mga 3 weeks na yan because I popped it.
Because
So
you
it's-
popped it. But
oo,
if a
dark scars.
Yeah, dark scars. At least it didn't mark. Others,
Oh.
becomes a mark pa.
Hindi pa nakita ni Doc G yung papagalitan ako.
Papagalitan ka. Ba't mo siya pinrate? Ba't mo siya tiniris?
From Carla, Doc, does kissing someone with bad skin cause breakouts? Asking for a friend. No!
Yeah, right. Talaga lang
Actually, hindi. Unless it's another skin condition.
Unless had-had yan. What's had-had ba in English, Doc? Ano yung mga common skin problems?
Had-had.
na-
I think it's the fungal.
Oo.
Yeah, it's the fungal.
I think springworm.
Yeah, it's
Oh my gosh, are you serious?
Yes.
Eh, di ba nakakahawa yun?
Wait, Google.
Google, when in doubt, Google. Okay, yeah. So, I guess, Carla, that's a no.
Yeah, it's a no. So you can kiss all you want, but
Woo!
you just have to wash your face after and toothbrush.
Oh, dapat fresh breath.
Fresh breath,
Jake and Kavita, pimples keep showing up along my jawline. What's up with that?
Probably he has hair along his jawline. So it's actually a fungal type of acne.
Oh my gosh,
So-
Oh, there's a fungal type of acne.
Yeah, because of the hair along so it's like a dandruff but here in the
In that area.
in the yeah.
Pero Doc, yung pimples sa jawline sometimes, when you have facial hair,
Yeah.
yung may ingrown.
Yeah,
ano ba yan?
it can be ingrown,
Oh.
but if it's really pimple, it could be due to a fungal cause. So we usually give like a very low dose antifungal medication or just the washing to dry out and then a
This
toner.
age, because usually they'd say that if you have a lot of pimple, coming out, they say that it's because nagbibinata,
Uy,
nagdadalaga.
grabe. Adult acne.
What about
Doc,
adults?
let's talk about adult acne.
There's really adult acne. So it's not just
So,
the
hindi ibig sabihin nagbibinata
because
siya,
because if you think about it, adult acne usually is caused by hormones. So it's hormonal.
Still hormonal.
It's still hormonal. Kasi syempre we still have hormones even until premenopausal.
Pero Doc, once women stop pag nagmenopause na talaga siya
Yes.
completely, may chance pa rin ba mag-breakout?
Of course, it's very less because of the hormones, lack of the hormones. But usually I still see some patients 30s, late 30s because they still have the hormonal changes. So they can still have the acne.
So that's one of the reasons why sometimes I hear some patients that say they're breaking out because they're nearing their
Period.
Yeah.
Periods.
Their
Because
cycle.
it's hormonal.
Because it's hormonal.
Yes.
Okay.
That's why you also usually refer, dermatologist also refers to the OB for, let's say, pills.
To normalize their
To normalize the
cycles.
hormones.
I see.
That's why some pills are famous because contraceptives. Some
Yeah.
contraceptives are famous because they actually cause brightening,
Like
or,
clearer skin.
clearing of the skin. Yeah,
Because they don't cause acne.
yeah, because they normalize the hormone.
Okay.
Again, tonight's topic is one we all deal with every single day. Our skin, you guys, whether you're acne prone, sun sensitive, or just want to look fresh kahit walang filter, this episode is for you. Healthline, Doc Rylan's with me, Dr. Ann Vicente, dermatologist with us. If you have any questions, please give us a call or just fire away on playback.tv/magic899. Your socials too, they can contact you.
Yes.
Yes.
Well, socials?
If you
You
have
can contact us or through our clinic. Yeah.
what's the name of the clinic, Doc?
I have a Cell Lab Beauty Clinic in Makati. It's a Korean partner clinic, so we do Korean procedures. And I'm also affiliated with the LASIK Plus Vision Center in Cainta.
Like,
The eyes.
Yeah, I'm also a ophthalmologist. I also
yung mga friends mo, Doc Rylan, mga double
Ayaw,
degree.
ayaw tumigil mag-aral, di ba?
Na-inspire tuloy ako
Sila
mag-master.
yung ano, double degree.
let's go.
And then, oh my gosh, you're also an ophthalmologist.
Yeah, but I'm practicing more. I love derma, so that's
the
yeah.
skin. Why the skin? What's the fascination with the skin, Doc?
Well, diba, it's always nice to look at beautiful skin.
I know, dream ko yan, Doc. Yung talagang like,
Beautiful naman your skin.
no, but I have a little foundation because I don't have clear skin. But like, I want
Well,
like,
I think we do all need a certain level of like, mahirap kasi. If you ask me, it's quite difficult to achieve like a totally flawless look.
Okay.
You have to have dedication for all those.
Which we don't.
yeah,
And then you
out
have
the window.
Yeah, go to your dermatologist for all the treatments to make you glass skin, tightening of the pores until no more filter needed.
No, diba?
I just use the filter in the phone.
Another question about, give me 1 second, Doc. Oily skin doesn't need moisturizer? True?
Actually, it still does.
It still does.
Yes, because
even if it's oily?
because there are moisturizers that are made for oily skin.
Oh.
Yes.
So I think that's where the key thing is. You have to
Yes.
really choose
Hindi, ganito lang, Doc.
which is which.
Ilan bang skin types? There's oily, dry,
and then normal, and then a combination.
Look at Doc
The
right
normal is actually a combination of the oily and the dry.
Can you look at someone's slick skin up front, like the way you're looking at me now, Doc? Can
And
you tell
tell
if
if
it's
Actually,
dry
it's
or?
it would be a little difficult if just through like bare eye because there's really a face skin analyzer. But well, technically,
microscopes and stuff.
Yeah, but when you look at technically like Doc Rylan, ano siya?
Kinis
makinis
eh.
siya, parang ganun. You
May
okay.
nag-aalaga ring derma.
Na.
So actually, yeah. So parang just looking at it, you have an idea, but you really can't say that it's exactly like that compared to having it done by the skin analyzer.
Oh, okay.
Yeah.
The skin analyzer, is that like does every derma have that?
Actually, even if you just take a history of the patient, how she does her
Routine.
regimen and everything, so you can actually get already the gist kung medyo oily ba siya, especially kung ano mga ginagamit niyang products, parang gano'n.
Oh, toothpaste. Is that a secret weapon really daw against pimple? Have you tried that, no? Kasi high school pa lang ako ginagawa ko na
Di
yun.
ba toothpaste, then lipstick, di ba?
Yeah.
Pati lipstick?
Hindi, meron pa isa, Doc. Wait. Ano ba yun? Yung parang
Toothpaste.
Chinese product. Wait, I'll remember.
Chinchunsu?
That one, Doc, that one.
Actually, it's because of the
Alam mo,
menthol. Because of the menthol, it dries it out
It's
because
menthol.
of the menthol. But actually, hindi. Kasi, if you really look at the pathogen, how acne forms, you really need to treat the P. acnes, the bacteria. It's
Okay.
just drying it out because of the parang mentholated siya.
So if your toothpaste isn't mentholated, it won't work.
I needed to find the Colgate.
Colgate.
Puti.
Yes.
Puti.
Puti.
Puti. Doc, can you actually sweat out toxins through your skin?
Of course, yes.
Okay, so that's why they recommend we do sauna daw? Tama ba yan?
Yes, correct.
To sweat it out.
That's why if somebody is drinking too much, you actually smell some of the
Alcohol.
the alcohol.
So it's not just
Because you sweat
it's
it
not the
out.
breath and all.
Yeah.
It's
Oh
sweat.
no.
Yes.
Okay.
Right?
Oh my
Even
gosh,
those
yeah.
who smoke too much, you can smell
From the
their
skin.
from their skin that it comes out.
If you could ban one skincare product forever, what would it be and why? I'm sure you've got something on your list. This is just a personal pecado. Is there one?
I cannot mention the brand, but I really
Wait, is there a generic name for it?
No. Because there's really one medicine that they give out to all my like almost all my patients, especially in my patients in the province. They give out a combination of antibacterial, antifungal, anti-inflammatory.
Combination of all.
Of all.
It's like a cocktail.
Yeah, it's like a cocktail as a ointment or as a cream. And then for all the skin diseases, they give it out to the patient.
It's like a
And then
magic.
the patient,
magic
it's like a magic
for
drug.
everything.
Yeah, of everything. And then when the patient comes to me, because I've been using this cream for 2 months and now it used to go, of course, it used to go away because it was a shotgun treatment.
But
And
if
then,
it's longer,
then you develop resistance to it no more. So, you have to go up because, they give you, I mean, the pharmacists, they don't need prescription. They just give it out.
so it's an over-the-counter.
Yeah, they just give it out.
medication.
Na, so may katika, you use this. Cream.
Oh.
So if there's one product na I wanna ban that because it really, oh my God, ano yun, magic?
Oh, okay.
Hindi yan yung Magic 89.
Yeah. Tayo.
Good one. High five, Doc. High five.
Good one.
Doc, have you seen any weird DIY skincare trend lately that you're like, whoa? Anything you've seen lately online na parang, very questionable? Kasi ang dami na talaga naglalabasan, di ba?
Yeah. I mean, TikTok has a lot.
Yeah, actually, I'm not really that into TikTok, but
Like just maybe like yung dapat naming iwasan or yung maybe consult with a dermatologist before we do it ourselves, di ba?
the trend that they had wherein they do the roller. There was a roller that came out na maliit lang ang roller and then they do it and then do it and do it. So, like every day. So, they're thickening their skin actually. Kasi sinusugatan nila every day eh. So, this is like...
Kakapal yung mukha, Doc.
Kakapal ang mukha.
Paano kung makapal na nga yung mukha to begin with?
Tapos kakapal pa, no?
Success.
Actually, yeah.
bawal.
That's the trend I saw na parang this is so disturbing because they don't put anesthesia because the needles are so small. But they roll it so they create micro abrasions or micro injuries. So if you do it and do it and do it, parang regularly, it's not supposed to be done regularly.
Here's one, I know I see this a lot on TikTok. No Pro, has Doc seen the kasoy cream? Have you seen that?
Yes.
Because like so many people swear by it. I mean, you see videos on social media. But what is it? Does it really work? Though?
Because it burns. It burns. So the kasoy cream, if they put it on the warts, it burns. The problem is, if you're sensitive,
So it
and
could
if
do
you have
more
peanut
damage.
allergy, because it's kasoy, it's a nut. So
Still a nut, okay.
yeah, there lies the problem. And then sometimes if you don't know how to put it properly, you burn the surrounding area.
So you do more damage.
Yes, because actually ang ano lang niya is talagang ano siya, nakaka-burn siya. So it's like doing laser or doing electrocautery.
Except na
ano
it's
siya,
quite
oil
specific.
siya.
Ito oil.
No, oil siya. So pwede mo siyang i-apply sa bahay.
Okay. Doc, what's the most surprising skin condition people often misdiagnose?
Usually the allergic type or the contact dermatitis. We call it's usually like they apply because they see a billboard in EDSA or along certain thoroughfares.
It's marketing.
Ang ganda-ganda niya, no? Di ba? Ang ganda-ganda this artist. So, sila din. And then, there was this she's a very, very famous actress, even up to now. She used to have a billboard, a very, very famous brand. So I have patients come in, wow, very bad melasma. It's because
Melasma is the darkening
the
of the
darkening
skin,
of the
Like
skin.
this.
So it's because of her billboard, she's so makinis, sobrang makinis.
So
when
they-
they see her and then there's the name of the brand, so they use it. But
Thinking
what they
that
don't know
they're
is
really good.
they were not told to use sunblock after you use that.
Okay.
So it does peeling of the skin, and then they go out, they go about
And
their
you
day,
have
and
sun-
then yes, now you
UV
have sun
rays and all.
damage.
Oh, more damage.
Super. And then they come to you, and then you have to treat the melasma, which is not that easy to treat.
Yeah.
Especially if it's already gone deep because of their continuous use of that peel thing. So, yeah. So actually, that's the
Oh my.
one of the,
Sino to?
Gulong ko na lang. Mamaya.
What about what about keloids? Not
Oh my
everybody
gosh,
has it.
yes,
So,
Doc. I have like a bad keloid from my C-section.
Actually, you can do laser for. There's actually laser for keloid, and there's injections, intradermal injections to lessen to soften and then lessen the size of the keloid.
Okay.
But if it's just early keloid, I still believe those contratubics or
the topical ones.
topical ones can,
massage.
if it's early.
This is 20 years old, Doc. I have a phantom itch. Minsan biglang, I don't know where it's coming from, but I know it's there. And then I guess apparently, Doc, pag ano daw pala, the nerves retract.
Yes,
Yes.
retract.
Oo, minsan talaga ang weird ng
Hinahati
feeling.
mo.
Oo, hinahanap mo talaga, Doc.
So you have to do the laser na or the injection because it's already been there a long time. So
Yeah.
the creams don't work anymore.
Creams don't work.
Yeah. I believe they just work about 2 years or a
So
little
less
long.
than that.
Less than that, they're actually still good because the
But
skin is
does it go back to normal skin or just decrease the thickness of the keloid?
lately the lasers have good
Really?
outcome already.
Wow.
But and also they combine it with injection with stem cells.
Ayan, ito na naman tayo sa
Stem cells na naman.
Yeah, stem cells.
Cha-ching, cha-ching! Yun ang naririnig ko
Yeah.
pa stem cells. Cha-ching!
Cha-ching talaga, but it's like
What's up?
Okay, go.
okay.
Would you rather give up sunscreen or moisturizer for a month?
Moisturizer.
Moisturizer.
Because your sunscreen can actually be moisturizing.
Okay.
You're not supposed to give up any. I mean, you're not supposed to choose between the two. But if you really, really have to give up one.
Is there such a thing as over sun protection? I mean, like if you have you apply something in the face that has like SPF like 50, and then your makeup nowadays has like SPF 30. Or,
Ano?
So does it add up? Not really.
Not really. But at
okay.
least there's an added layer of protection.
Oh.
No,
So I
over
was thinking,
sunscreen.
you're like over 100 if you count all of these things.
It
that you apply
doesn't
on
work
face.
that way.
Oh,
Additive.
See, that's why I'm pouring math.
Diba? No over sunscreen ka.
Over sunscreen ka.
So there's no such thing as over
No,
sunscreen.
wala po.
Okay.
Doc, what's the real deal with glass skin? Can Filipinos with oily skin achieve it naturally?
Actually, glass skin is not oiliness. It's actually moisturized face. Kaya siya parang glassy. Kasi moisturized
So it's
yung
not
face.
oil.
It's not oil.
So it's moisturized.
It's
Moisture.
moisture. There's a difference. So,
Moisturized
pag oily
skin.
ka, hindi po siya glass skin.
Wow.
Yeah.
We should.
Mahirap ka lang.
Aray ko.
Pour ka lang pag oily yung skin mo.
So, yeah, you can achieve it. There are actually, but I believe the procedures more than the pahid-pahid will lead you to the glass skin. More than the pahid-pahid.
Marielle, again, sleeping in makeup, how bad is it?
Very bad because it clogs your pores. So when your pores are clogged, you activate the bacteria, you activate damage. So yeah, it's the clogged pores. Yeah.
Okay. Doc Rylan, oh my gosh, it's 7:53. That went
know.
by so
It's so
quick.
fast.
See, Doc, diba? Doc, and that means you're just gonna have to come back. No.
Yeah,
There's a part two.
Right.
Part two.
We're gonna have
Ang
a
dami
part
kong
two.
questions actually But finish the sentence, Doc.
Yes.
The one thing I wish people stop doing to their skin is
Over abrading the skin. Yes.
microdermabrasion. Ganun.
Yes,
Okay.
over.
Or even the
Even the
exfoliation thing.
loofah, the exfoliation.
Oh, even the loofah. Okay.
Because it abrades your skin. So it destroys.
Just they have
How
this,
many
like,
times are you supposed to do that anyway?
Twice a week only.
Twice a week.
Yes. You can only exfoliate.
You don't need it, Doc.
Kasama yan, there's just like stones and stuff that they use to scrape and scrub and everything
Eh,
else.
mga guasha, ganun. Diba?
Wash naman is I think not like a
That's not-
part regular skincare.
okay.
So you don't do it every day. I don't know. I haven't learned gua sha yan.
No, nakita ko lang.
But nakita ko lang, but I don't think they do it daily eh. So yun kasing iba, they obsessively like exfoliate or use the ones with loofah.
So, Doc, for the listeners out there who want to maybe do a consultation with you, where can we find you?
Yes, you can find me in Cella Beauty Clinic, 7th floor, Centuria, Makati. I'm there Monday, Wednesday, Friday or Saturday. So you can call.
Sipag ni Doc.
Yes, you can call my secretaries during Tuesdays and Thursdays. I'm in LASIK Plus. Tuesdays, Thursdays, Saturdays, I'm in LASIK Plus Center. So I do the eyes during those days. In Cainta, in Santa Lucia Mall in Cainta.
Doc,
See,
Doc, and thank you so much for
Thank
joining.
you so much.
And the
Thank
Doc,
you for having me.
Oh, you definitely come back.
there's gonna be a part 2, definitely.
Yes.
Exactly.
Okay.
You don't need microdermabrasion. You're good.
You also don't need it.
Hang on tight for the boys. We'll leave you all with something from Jin. Catch us back next week. Bye.
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 Magic 89.9.